Welcome to Care Without Crisis, a video series by Vanguard Care Solutions.
Hi, I'm Dean Matthews, and I'm a caregiver advocate. I started Care Without Crisis to help adults and aging families be more prepared for senior care before it became a crisis. I noticed years ago when my friends started having children that there was no shortage of resources to help them raise their kids or even prepare for college. However, the same could not be said for senior care and caring for your parents. At this very moment, my siblings and I are in the thick of it, doing the best we can, preparing for and caring for our aging parents who are in their 90s. But the fact of the matter is we weren't ready. We just were prepared. And when I talk to my friends and contemporaries, they're even less prepared than we were. So Care Without Crisis is a way to help slow that whole process down, whether it be estate planning, whether it be health insurance, whether it be caregiving. We need time to plan for it. You know, with people living longer and healthcare advances and medical advances, it's not beyond the realm of possibility that you may need to care for your loved ones for 5, 10, 15, 20 years. And that kind of financial burden on families can be unbearable. So this is a way for us to get ahead of it so that you're more informed, you're more prepared, and you're more supported. So thank you in advance for being part of the conversation. Every family eventually faces a moment when a loved one is hospitalized and decisions that felt distant become urgent. And today we have a guest who spent several decades working inside that moment. Alia Gupta's experience as a certified case manager and patient care coordinator at Kaiser Permanente, where she led discharge planning and care transitions, should be very helpful to us and those listening today and watching. She's worked across Washington Hospital Center and Holy Cross Suburban Hospital and brings a perspective most families never get to access. So what she knows about hospital work and what families don't know is exactly why she's here. Alia, welcome.
Thank you so much for the introduction, Dean. It's my pleasure to be here. Thank you for having me.
Thank you for joining. So I'll get started. You started as a bedside nurse at Washington Hospital Center and have worked across nursing, clinical training, care coordination at Kaiser. What was the thread that kind of connected all these chapters for you? What pulled it towards coordination and navigation side of care in the first place?
As a bedside nurse, you're not always thinking about the coordination of care and what actually goes on behind the scenes in terms of how do patients discharge from the hospital. So I started as a bedside nurse, as you mentioned. I loved taking care of patients, but what I noticed quickly was that a lot of families get really stressed out, and it came not only from the illness, but also from the healthcare system itself. So that I definitely saw as a big issue doing bedside nursing. People were constantly asking things like, what happens next? Who do we call after discharge? And I didn't necessarily have answers. So naturally, that kind of pulled me towards care coordination and case management. It's a role that allows you to connect the clinical care with the next steps for the patient. And it helps families also navigate the very complex healthcare system because it can feel very confusing. There's a lot of moving parts. You know, when I started as a bedside nurse, I just thought that nurses and doctors and medical professionals worked in hospitals, but slowly but surely I started to realize that wasn't necessarily the case.
Very much so, and I've been there myself. So let me ask you, for families who've never heard the term patient care coordinator or case manager until they're sitting in a hospital room, how do you describe what you actually do in plain language? What does a typical day for you look like?
In simple terms, case managers and discharge planners help ensure that the patient leaves the hospital safely with the right plan of care in place. That includes arranging rehab, home care services, durable medical equipment, transportation, follow-up appointments, and making sure the patient's families understand the medications that a patient may be taking. That's a huge part of it because transitioning out of the hospital setting into the home setting or the next level of care, we want to ensure that goes smoothly. And a lot of times that's where a lot of gaps occur because patients can get readmitted, they can go home and potentially fail in any of these locations and may end up back in the hospital. So a typical day looks like coordinating care and working with the doctors, the nurses, the physical therapists, all members of the interdisciplinary care team to make sure that patients do transition safely out of the hospital.
You've worked across a lot of different environments, a number of different hospitals. Do you notice consistent patterns about how families experience hospitalizations across different settings?
Yeah, I think a big pattern that you see across hospital systems is that families are not always prepared for how quickly the patient is going to leave the hospital. Healthcare has changed so much in the last several years, from even C-sections a week long in the hospital to now just 2 days, maybe 3. But you definitely see that the expectations don't always meet up with the reality. Even though the medical care can be excellent, the pace of that care can be surprising to patients' families. Decisions about discharge, rehab, home care sometimes happen within 1 or 2 days. And if the families don't understand that process, it can feel overwhelming.
I was that family. Yeah, we went through that as a family. A woman told me once that discharge planning starts at the time of admission, which I thought was interesting, but I get it now, but I didn't at the time. So I would ask you, what are the common things that families, I guess when they realize how fast things are moving, what do you commonly hear from families? You have to kind of ease the tension, but what are some of the things that you typically hear from a family?
I think that's the crux of discharge planning and case management, is that discharge does start on admission. We try to preface that because of the way that the healthcare system moves so quickly nowadays. We do want to make sure that that's understood, or at least put that out there. Some of the things that I commonly hear from a lot of family members is, what level of care does the patient need at this point? There's a change in the baseline status and they need rehab, for example. Even though we push home care first, that may not always be the safest discharge plan or next step for the patient either. And sometimes when that is the case, say the patient can't go home, they need placement in a rehab or a long-term care or an assisted living facility, or even in the home setting, a lot of families will ask what services are needed. And they've never had home care before, so they're wondering, what does that even entail? What services are going to be provided? How long is that going to be for? And those are all valid questions. And then who do we call or who do we contact after their family member or the patient leaves the hospital? That's also another big one, because families can feel alone in the discharge planning process. Caregiver burden is already part of the equation, and now there's a change in status of their loved one. It's a lot of questions regarding how prepared they are, and it helps the family members feel prepared for that discharge process and that next level of care.
Yeah, it sounds like, in hindsight, I would ask you, are there questions that they should be asking? I think maybe you touched on some of them, but can you think of any others that maybe they should ask at that moment when the loved one is going discharge, or before their discharge rather? What sorts of questions should they be asking, or are they missing? Did we miss anything?
I think before getting to that step, how involved are the families and the family members in the patient's care also? Is there that open line of communication between the interdisciplinary team to say, hey, here's what's going on with your loved one at this time, so that we can come up with the best care together and set expectations and make sure that that's realistic? Because a lot of times patients' families do feel blindsided. Oh, my patient's family member needs to go to a long-term care facility, and that could be hard to get set up, especially in the time crunch or not having enough time. So definitely asking questions of, what is the next level of care? What does that entail? What is subacute rehab? How long will they be there? When will they get discharged? Things like that.
I would ask you, this is sidebar, but you brought up a really interesting point to me, just understanding the nomenclature and subacute rehab, and even, I know now what home care is, but skilled nursing versus rehab versus assisted living versus acute rehab, subacute rehab. Can you speak to what each of those means? Because a lot of us, when we're in that space, we don't know. We'd like to educate folks so they know at least where to go to try to understand it a little bit better.
Right. I think even before I started doing case management and care coordination, that was something that I was also interested in myself, just not knowing what that really entailed. So, for example, if a patient is being discharged with home care services, walking the patient and the family through what that realistically means right now related to mobility. Is this a new baseline for the patient? What are their activities of daily living? Are they able to care for themselves? Do they need help? How much help? trying to quantify that so that they can get to the next safest level of care. Are they safe in the home? Are they able to live on one level? Is there a bathroom on that level? Do they need to be in a facility because the patient's family members aren't able to take care of them with their new baseline functioning? Are they able to, again, back to ADLs, I think that's a huge indicator of what a person is able to do at that time. Because if the wrong level is chosen, it can lead to caregiver burnout, safety issues at home. That conversation is really important. What do these different levels of care entail?
Okay. So let me ask you, I don't know if this has happened to you, but I've seen it happen. It hasn't happened to my family, but families don't always agree that their loved one should be discharged. So they have rights, and how can they advocate without creating conflict for the care team? If you don't feel someone's ready to come home, what can they do, or can they do anything?
Yeah. And I do get that a lot, because a lot of times here they are in a crisis situation, their family members come to the hospital, all of a sudden they're getting discharged, it seems. The families definitely have a right to ask questions, request clarification, be part of that decision-making process. That's a huge piece of the puzzle, and a puzzle piece that us as case managers and discharge planners definitely need. So my advice is always to approach the conversation collaboratively, asking things like, can we help you understand the reasoning behind the plan, and how can we do that? Do we need to have a family meeting? What is it that you don't understand? Or let's go over the options again. When everyone works together, the goal is always the same for the patient, which is to safely transition the patient to the next level of care.
Okay. I want to shift gears a little bit. So having worked inside hospitals and inside insurance company at CareFirst, I also worked at CareFirst, and now at Kaiser, where do you think the biggest gaps exist for families navigating care transitions? Where's the disconnect? Or do you see a disconnect?
Yeah, there's a lot of delays, and I think that's a huge part of it. There are a lot of barriers that come into play, especially from the insurance end as well. What type of insurance do I have? What does my insurance cover? What does it not cover? Do I need authorization? If I need authorization, what's my rehab choice, or which home care agency accepts my insurance? Is there bed availability at the rehab, the acute rehab, the subacute rehab? Say I need long-term care. Do I already have Medicaid? Do I need to apply for Medicaid for long-term care? It's a lot of coordination between multiple individuals and providers. We do spend a lot of time on the phone trying to get authorization, remove barriers so that the patients can get to the next level of care. I think what helps the most is for families to stay engaged and ask questions early and make decisions as promptly as they feel comfortable to, because that can prevent unnecessary delays in the process. For example, when family members ask me about various rehabs, I say the best thing to do is probably not only go on the CMS Compare website and have a look, but sometimes those CMS stars can be deceiving. Going to the facility is your best bet. Check it out. How do you feel? How does it smell? Use your senses. I always encourage family members to be advocates for their family members as well, for the patient, because when somebody does go to a facility, there is sometimes an unrealistic expectation that the subacute rehab is the same level of care of a hospital. The nurse's aide will get there quickly. The nurse will get there quickly and answer the call bell. That's not always the case. I think it can be disappointing sometimes when you go to the next level of care and you think that it's going to be a hospital scenario. Yeah. Unfortunately,
a lot of people get that that experience, and it's just a little different than what they thought it might be. So I will ask you, and this is kind of the section of what families can do. So if you could get families to do two things before hospitalization, when everything is calm, everyone is healthy, are there some things, given your medical background, that you would recommend families do while their family or their parents or their aging loved ones are still relatively healthy?
This is a really great question. I think when I started nursing and I started case management, I didn't realize that there were things that could be done in order to make that transition smooth, especially out of the hospital, based on what the families and the patient want. So 2 things that I think families should do before going to the hospital is definitely talk about what the patient's medical wishes are and decision making. Who should that be? What does that look like? Do you have a power of attorney? Do you have a living will? any type of legal paperwork that can really help. Do you want to be intubated? Do you want artificial feeding? Things like that. Because these types of advanced directives can really help with the care coordination. And just knowing some basic medical history and the insurance information really makes a difference. Also, medications ahead of time can make a stressful situation much easier to navigate.
You're gonna tee up another conversation I'm gonna have with some attorneys, but that was helpful. You led me into, because I was thinking what tends to happen when these conversations never take place. Like when what you just described does not occur and a loved one is in the hospital and a medical team needs documentation, what then happens if you don't have anything in place? What, I'm gonna assume some comes next, but I hope it's not chaos, but I'm sure it's confusion.
Yeah, definitely. So that's a really good question, especially since you don't always know what's going to happen when a patient goes to the hospital and what they want prior to going to the hospital. Maybe they don't want a procedure. Then it's going to be a matter of determining if they have capacity to make medical decisions or not, working with the medical team. The medical team can give suggestions and say, hey, I think that you should have this procedure, or I think that a feeding tube may be good for you. Maybe a critical situation when a patient's unconscious, do you want intubation or not? That may not be something that you want. So yeah, to your point, it can become very chaotic, especially not knowing what that patient wants in that moment if there isn't anything in writing prior to that. Yes, so it can be chaotic.
Okay, I'm going to close out with a few more questions. What do you wish families understood about what case managers are generally trying to do for them? Even when the system, the timelines, the insurance rules make it feel like you're working against them, what can you convey to families to let them know that you're really advocating on their behalf? I feel like sometimes people feel like that it's a fight against an immovable wall. And there are people in the hospital that are really fighting for them. But I think in a moment of crisis and fear, they don't really understand that. So what would you say to them?
Yeah, so that's a big question. I think that I wish that families and family members would understand that case managers are care coordinators who genuinely want the best outcome for the patient. Sometimes we're working within system limitations like insurance rules, bed availability, and our goal is to always help the families to navigate the process and find the safest solution possible. We want families to know that we are working with them and that this is a collaborative effort to do the best and do right by the family member and right by the patient. It may not feel like that sometimes, but we are here to support and provide information so that they can make the best decision and the right decision, hopefully, at the end of the day.
That's awesome. I think you answered 2 questions in one, so thank you. Very efficient. Well, Leah, I want to thank you for joining me today. We've been having a difficult time getting this on the calendar. I know you're very busy, so very much appreciate your time. And I'm sure your words are going to help some folk. You helped me, so you're going to help some people with what you shared with us today. So thank you so very much for your time. And I'm going to be in touch with you very soon. So thank you so much.
Thank you. This was totally a pleasure. I really appreciate it.
Every
Thank you for joining us. Are you ready for a plan? Contact us today for your personalized care assessment. Get started online at any time at www.vanguardcaresolutions.com.